Right then, welcome to the deep dive. We get a stack of sources, right, and pull out the most interesting bits, and today we're looking into Mounjaro,
Oh, yes.
a new type 2 diabetes medication. It's causing a stir here in the UK, wouldn't you
Yeah,
say?
absolutely. Lots of buzz.
And joining me is a medical expert who knows all about diabetes and the latest treatments. Welcome to Deep Dive.
Pleased to be here.
So, let's get started, shall we? For anyone who's not in the know, what is Mounjaro and why all the excitement?
Well, Mounjaro, or tirzepatide, is a new type 2 diabetes drug,
Made by.
Eli Lilly, and it's different from other diabetes meds. It's a dual GSP and GLP-1 receptor agonist. Quite unique, actually.
Now that sounds pretty technical.
It
Can you
is.
simplify it a bit? What does dual agonist even mean, and why is that so special?
Of course. So GLP-1 receptor agonists are already a standard diabetes treatment, helping the body produce more insulin and lower blood sugar. But Mounjaro, it activates both GLP-1 and GIP receptors. This dual action is what makes it stand out. Tackling blood sugar from multiple angles, it's led to some impressive results, especially in lowering HbA1c.
Now, HbA1c, for those of us who don't speak doctor, it basically measures your average blood sugar over a few months, right? So, lower HbA1c, better blood sugar control.
Precisely.
Okay.
And clinical trials, like the SURPASS series, have shown that Mounjaro is remarkably good at lowering HbA1c, even more so than other GLP-1 receptor agonists.
So, better long-term blood sugar management, possibly fewer complications?
Exactly.
Mounjaro, it's outperforming the current best when it comes to blood sugar control. That's pretty impressive. But it's not just about blood sugar, is it?
Yeah.
There's all this talk about its impact on weight loss, and I've got to say, this is where it gets really interesting for me.
Absolutely. Weight loss is a major benefit we've seen.
Uh-huh.
I'm not talking about a pound or two. Clinical studies have shown patients losing over 20% of their body weight.
Wow. That's a lot. Let's see, for someone who weighs, say, 20 stone, that's a loss of 4 stone. That's a big change.
Definitely. This weight loss is especially important when you consider the connection between obesity and type 2 diabetes. We know that obesity really increases the risk, makes it harder to manage blood sugar levels.
Mm-hmm.
So a medication that tackles both issues, now that could be a real game changer.
Absolutely. It's addressing the root, not just the symptoms,
Fix.
not just about fitting into your old genes. It's about tackling those health problems that come with the extra weight. Heart disease, joint issues, the list goes on. But we have to talk about side effects. No medication is perfect. So what should people know if they're thinking about Mounjaro?
You are absolutely correct. Like any medication, it does have potential side effects. The most frequent ones, they tend to be gastrointestinal, things like nausea, vomiting, diarrhea, constipation.
Oh, right.
These happen in a good number of patients, sometimes even up to 40%.
It's a lot.
But these side effects are usually temporary. They tend to go away as the body adjusts to the medication. Adjusting the dose can help manage them.
So those gastrointestinal side effects, yeah, they might not be pleasant, but they're usually manageable and shouldn't, well, stop people from considering Mounjaro. Anything else?
Reduced appetite.
Oh, that's interesting.
It can be seen as a good thing for those wanting to lose weight. Naturally, it means that they'll consume fewer calories.
Less snacking, maybe. Fewer takeaways.
Exactly. But we do need to be careful, ensure patients are getting enough nutrition, not becoming undernourished because they just don't feel like eating.
Right. That makes sense. So we've got the gastrointestinal issues and reduced appetite. Not ideal, but manageable. But are there any bigger worries, red flags to watch out for?
Yes, there are a few more serious ones, though they are rare. Pancreatitis, for example, inflammation of the pancreas.
Okay.
It's rare, but it has been linked to using Mounjaro. So if a patient has sudden, severe abdominal pain, they need immediate medical help.
Right. That's serious. Anything else?
Another thing, mainly from animal studies at the moment, is a potential risk of thyroid tumors, particularly in patients with a history of medullary thyroid carcinoma, or MN2.
Now, just to clarify, MN2, or multiple endocrine neoplasia type 2, that's a rare genetic condition affecting the endocrine system, including the thyroid gland. So anyone with thyroid problems, especially MN2, should be cautious, maybe avoid Mounjaro altogether.
As a precaution, yes. Better to be safe than sorry until we have more conclusive data.
Right, makes sense. Any other potential issues to add to the list?
One more, gallbladder issues.
Okay.
Rapid weight loss, which is often seen with Mounjaro, can sometimes lead to gallstones.
So not the medication itself, but a consequence of its effect, the rapid weight loss.
Exactly. It's something to keep an eye on, particularly for those already at risk for gallbladder problems.
So While Mounjaro has some impressive potential benefits, it's crucial to be aware of the possible downsides. Pancreatitis, thyroid concerns, gallbladder issues, all things to consider. Shows that even with these new wonder drugs, it's always a balance of risks and benefits. But let's move on, shall we, and talk about who might benefit the most from Mounjaro. You can't just go to your GP and demand a prescription, can you?
Not quite. It's definitely not a first-line treatment for type 2 diabetes. It's typically for those who haven't responded well to the more standard medications, like metformin.
Right, so for those who've tried the usual methods and are still struggling, that makes sense. Anyone else who might be a particularly good candidate for Mounjaro?
People with a high BMI or those dealing with obesity-related complications are often considered good candidates. It might also be helpful for individuals with metabolic syndrome,
Which is?
a bunch of conditions that increase the risk of heart disease, stroke, type 2 diabetes.
So it's not just for folks with full-blown diabetes, it can also help those at high risk of developing it.
Potentially, yes. Especially if there's a strong chance of developing type 2 diabetes later on.
Okay, we have a good idea what Mounjaro is, how it works, its pros and cons, and who it might be good for. But let's get practical. What about its availability here in the UK? Is it easy to get on the NHS? Or is it one of those pricey wonder drugs only the rich can afford?
Well, good news, Mounjaro has been available in the UK since 2023,
Oh, good.
and it's becoming more widely used. However, we do have to talk about the costs.
Yes, the cost. So how much is this miracle drug?
It is not cheap. We're talking around £150 per dose.
Okay, so that's £600 a month.
Roughly, yes.
That's quite a lot. I see why you said choosing the right patients is so important.
Absolutely. At that price, we need to be sure the patient will really benefit from Mounjaro.
Makes sense. What about NICE, the National Institute for Health and Care Excellence? Where do they stand on all of this?
They are currently evaluating Mounjaro for wider use in treating obesity. Right now, they recommend it for people with a BMI over 35 who have at least one weight-related health problem.
So they see its potential, but are being careful, especially given the cost.
Yeah.
A balancing act, really.
Exactly.
Weighing up the possible benefits against the financial impact on the NHS.
Indeed.
Well, I think we've covered a lot. The science behind Mounjaro, its potential benefits and risks, the cost, and where it fits within the NHS. Before we wrap up this part of our Mounjaro deep dive, I'd like to look at its potential long-term implications. Could this be a turning point in how we deal with diabetes and obesity?
A very good question.
That's what we'll be exploring next. So we've talked about how Mounjaro could change things for individuals. But what about the bigger picture? We've got this global epidemic of obesity and type 2 diabetes putting a huge strain on healthcare systems. Could meds like Mounjaro be part of the solution?
Well, it's a question many are asking.
Yeah.
And for good reason. Both conditions have been rising for decades.
Right.
It's not just about physical health either. There's the emotional burden, the social stigma, and of course, the cost of managing these conditions long term. It's a complex problem that needs a multifaceted approach, you see.
Absolutely. And while lifestyle changes, diet and exercise are vital, they don't always work for everyone.
You're right. And that's where these new medications like Mounjaro become so important. They can help people reach and maintain a healthy weight, manage blood sugar levels, all while working alongside those lifestyle changes.
It's like providing extra support
Yeah.
to help people get back on track, when you say.
Yes, exactly. Medication becomes part of a broader strategy, working in tandem with lifestyle changes to get the best possible outcomes.
It's interesting because for years, the focus has been on personal responsibility. Eat less, move more, kind of sort yourself out. It's an important message, but it doesn't always tell the whole story. We know there are complex biological factors at play, genetics, hormonal imbalances, even the environment. It's not always as simple as willpower.
You've hit the nail on the head there. Obesity and diabetes are complicated. There are a lot of factors. And that's where meditations like Mounjaro come in. They address those underlying biological drivers, give individuals a better chance at taking back control of their health.
Almost like shifting the narrative, moving away from blame towards understanding and support.
Yes, I think that shift is key. Acknowledging the complexity so we can develop better, more compassionate treatments.
So Mounjaro could be a big part of tackling obesity and diabetes, but it's not a magic bullet. What are some of the challenges and considerations we need to keep in mind?
Well, one of the biggest is the cost, as we discussed earlier. Mounjaro is expensive. And with a public healthcare system like the NHS, well, it raises questions about affordability and access.
It's a tough one, isn't it?
Yeah.
Deciding who gets access to this medication and who doesn't. especially when resources are already stretched.
It is. This debate will only get stronger as more new medications come out. We need to ensure these treatments are available to those who need them most, regardless of their financial situation. Finding a balance between individual needs and keeping the healthcare system sustainable.
That balance is key. Cost isn't the only challenge, though. There's also long-term safety and potential side effects we don't know about yet.
True, early trials show it's safe, but it's still early days. More long-term data is needed to really understand the risks of using Mounjaro over a long period.
So to watch this space situation, proceed carefully, and keep gathering data.
Exactly. Embrace the potential, acknowledge the unknowns, and be cautious.
Stepping back a bit, Mounjaro's impact goes beyond just individual patients. It could reshape healthcare systems. Here in the UK, the NHS has traditionally been quite siloed, separate departments for diabetes, cardiology, weight management, and so on. But Mounjaro, impacting multiple areas, challenges that.
It does. It's started conversations within the NHS about a more integrated approach to healthcare, moving beyond treating individual conditions in isolation and starting to address the connections.
Because it's all connected. Obesity leading to diabetes, diabetes leading to heart problems. It's a domino effect.
Precisely. As you said, the NHS has often worked in silos. Mounjaro is making us rethink. Do we need to create new integrated clinics? Do GPs need training to manage both diabetes and obesity more effectively? These are the questions being asked.
It's a logistical challenge, but also a chance, wouldn't you say? A chance to create a system that's more efficient, more effective, and really focuses on the patient.
Absolutely. Mounjaro isn't just a drug. It's pushing for change within the NHS, making us evolve, adapt, and think differently about healthcare.
And this move towards integration, it's happening worldwide, not just in the NHS.
That's right.
Mounjaro is just one example of these new medications blurring the lines between medical specialties.
Indeed. We're moving from a world of specialists to generalists. Doctors who see the whole patient, not just one part of their health.
Empowering healthcare professionals to give more holistic, personalized care.
Precisely.
And that's the goal, isn't it? Putting the patient first, giving them the best chance at a long, healthy life.
I completely agree.
Well, I think we've really explored a lot in this deep dive on Mounjaro. From how it works to its potential to revolutionize diabetes care and reshape the NHS. It's fascinating, and there's still a lot more to come.
There is. It's a field that's changing quickly. I'm looking forward to seeing what happens in the next few years.
Before we wrap up, I want to leave our listeners with something to think about. With obesity and diabetes increasing globally, and medications like Mounjaro showing such promising results, are we seeing a big change in healthcare? Are we shifting from reacting to problems to a more proactive, preventative approach? It's a question worth considering, and I encourage you to explore it further.
A very interesting question, one I'm sure we'll be discussing for a long time.
And on that note, I think it's time we come up from our deep dive. Huge thanks to our expert for sharing their insights. It's been great having you on the show.
It's been a pleasure. Always happy to dive into these complex issues.
And to our listeners, thanks for joining us on this journey into the world of Mounjaro. We hope you've learned something new, maybe even started some deep dives of your own. Until next time, keep exploring, keep asking questions, and keep diving deep. Cheers. So we've talked about how Mounjaro could be, well, a game changer for diabetes care, even change how we think about healthcare in general.
Yeah.
But let's focus on something really important, especially here in the UK. How does this all fit in with the NHS?
It's a really important question.
Yeah.
Mounjaro, it's definitely got people talking within the NHS.
Right.
And it's not just about the drug itself. It's about, well, it's about how it could change our whole approach, really.
Exactly. If we have a medication that can actually tackle both diabetes and obesity, it changes everything, doesn't it? Resource allocation, services, the whole system.
Absolutely. It challenges us to think about healthcare, well, more holistically, to move beyond treating things in isolation and see how it's all connected.
Right, like we said before, obesity often leads to diabetes, diabetes can lead to heart problems, and so on. It's a chain reaction.
Exactly. And the NHS, traditionally, it's been quite siloed, wouldn't you say?
It has.
You've got diabetes clinics, cardiology departments, weight management programs, all working separately.
But Mounjaro, it shakes things up.
Yeah.
You've got one medication affecting multiple areas.
And it forces us to rethink how we deliver care. Should we create new clinics, integrated ones? Do GPs need more training to manage both diabetes and obesity better?
It's a logistical headache, to be honest.
It is a challenge, but it's also an opportunity, I think. An opportunity to create a healthcare system that's more efficient, more effective, and ultimately more patient-focused.
So Mounjaro, it's more than just a new drug. It's a catalyst.